Hi, I'm Nadia Blanchet, and today I'd like to talk to you about how to use Nitropaste to help preserve the blood flow to the breast after a nipple-sparing mastectomy. One of the exciting developments about breast reconstruction in the last few years is that we try, whenever possible, to save the nipple-areolar complex. That's the nipple and the skin around the nipple called the areola. And this helps our results to look so much more natural because the scar is hidden, the nipple is kept, and the shape of the breast is actually better also because the scar does not distort the shape of the breast. Unfortunately, the nipple-areolar complex is exactly where the blood supply is the worst on the breast flap, and so there are modalities to help improve the blood flow to the skin. One of them is a nipple delay, which is discussed elsewhere on my website, but another technique is using Nitropaste to help increase the blood flow to the nipple-areolar complex. You may know that men and women sometimes use Nitropaste to increase the blood flow to the heart when they're having chest pain because it increases the circulation. Using the same principle, you can put Nitropaste on the nipple-areolar complex and increase the blood flow to the nipple, and the nipple's more likely to live. Let me show you how to do that. So, it's really important for you to wear gloves for this procedure. Not so much because it's a sterile procedure, because it isn't, but because the Nitropaste can give you a really wicked headache if it touches the skin too much. So you're going to wear gloves, non-sterile, and put them on. And then, this is the Nitropaste. And you'll either have a packet or a tube. And so, if you have packets, just open the packet and put the smallest amount of Nitropaste that you can onto the tip of the Q-tip. The key is to increase the blood flow to the nipple without causing a headache, and that's the tricky part of this procedure. So this is kind of looks like a breast. Here's the breast, here's the nipple, and let's say that this is the bluish area that we're concerned about. You're just going to put a little drop of Nitropaste on the part that's blue, which came down like this. And so that's a tiny amount. That's enough to increase the blood flow to the nipple, but not enough to give you a headache. Now say the area that was blue is larger, you might put an area of Nitropaste that's this big. You probably won't put the same amount of Nitropaste on both nipples, and you may only be doing it on one breast and not on the other breast. After you've put the Nitropaste on, you're going to put a non-stick dressing on. This is called Telfa, and it's a non-stick dressing, sort of like the inside of a Band-Aid. You're going to take a little piece of this because you don't need all of it, and you can buy Telfa at any pharmacy. And so then you're going to cut a piece like this, and then the Telfa is going to be stuck down onto the breast like this, and that way it doesn't get in your clothes. You are going to do this once a day, twice a day, or 3 times a day, depending on how worried we are about the color of your nipple and whether or not you're having any side effects or headaches. You're not going to stay at the same dose of the Nitropaste throughout the treatment. You might start out 3 times a day and then drop down to twice a day and then drop down to once a day. The most important thing is to make sure that you just put it on the blue area, and that you know that you are always welcome to come to my office so that I can see you in person. You can send me an email, you can call the office, but I'm always available for me to see you and check it out in person and guide you through this process. Good luck.